It is, and it's actually a funny story. And this is going to be my first time talking about it live, but it's great.
Welcome to the show.
Thank you so much for having me. And that's absolutely right. You slid up into my DMs, and I'm glad you did. I'm excited to be here. This is my first actual health podcast. Usually it's about entrepreneurship and lifestyle stuff. So thank you so much for having me. I'm very excited.
So let's get into a little bit about your background and what got you into this entrepreneurial business. So what's your medical background like, and how'd you get involved in Instagram?
Sure. So I'm a little atypical as far as my background goes and what I'm doing now, obviously, you know that. Growing up, I never had any family that was doctors or anything.
Okay.
But, you know, in college, I really had two loves, and that was business and medicine. And I discovered medicine on my own. I got a job as an emergency room scribe when I was a sophomore in college, and absolutely fell in love with the whole process of diagnosis, treatment, the hospital. And I noticed a lot of flaws in the healthcare system. And I've never actually done any business in healthcare. Business has always been separate.
Yeah.
But, you know, I'm an entrepreneur at heart, but I'm also a doctor at heart, filled with empathy, filled with resourcefulness, and I hope to apply that to healthcare one day.
Great. And I just wanted to know, how'd you get involved? Like, did you just post a picture and it went viral? Some people I've had on the podcast, I actually interviewed a Instagram, medical Instagram guru, basically, and she was like, I posted a picture in Scrubs and Fig Scrubs or All Scrubs. I don't remember which company it was, but they contacted her for a sponsorship. Did that kind of happen to you too, or did it happen in some other way?
Yeah, so you can go over the Instagram kind of trail how it happened. It was actually my third year of medical school as we were studying for the boards. And at that time I had like 2,000 followers, just like friends from college and whatnot.
Yeah.
And I actually wanted to learn how to do digital marketing for one of my other companies.
Okay.
And one of the things that I got really good at was Instagram marketing for that company, how to grow an Instagram account, how to scale one, how to use kind of automation and collaboration as tools. So I noticed, this trend in, you know, being a medical influencer, a doctor influencer. Other people were doing it. Dr. Mike, we were talking about him earlier as the prototype for kind of medical influencers. But I'm like, these people are doing it, and people are responding really well. So my roommate and I, Ben, at B-Clutch, we started to do the same thing and just kind of mimic that material. We noticed that people really liked seeing pictures of us in scrubs and, you know, what we were going through in medical school. We had a casting post that went viral during casting clinic, an intubation Olympics that we did that went viral. And it all just kind of snowballed from there. But we really just stuck to the same model of this is, you know, we're posting content for other pre-meds, aspiring medical students, and other medical students.
Yeah.
And, you know, there's really no secret. It was just consistency. And it's been 2 years since we started doing this.
Yeah.
At the beginning of third year, end of second year. And it's incredible, the opportunities that have come along. And there's a lot of tools that we've used to grow our Instagrams, including automation, collaboration. And those tools have changed and evolved a lot since we started this thing.
So clinically, looking to the future, we talked a little bit about the past. What do you see Instagram becoming in your life as a doctor and your life as an entrepreneur?
Yeah, definitely. So Instagram, like any other form of media, is just an outlet to disseminate information to an audience.
Right.
And if you use it correctly, it could be a very powerful tool of getting the right information to the right audience. And right now, I know you see all my content is kind of like fun for medical students, and that's because I'm not an actual doctor yet. I have another 4 months. But what I would like that to be, my vision for it, is I want to help, you know, take all the new research, take all the old research that's being proven wrong, package it nicely and in a funny and engaging way, and get that to the people that need it. And I think that's one of the big problems with healthcare now, is all the information isn't being presented correctly. People don't know the up-to-date facts about nutrition, about the new treatments that, you know, the insurance doesn't cover, but they increase longevity. They increase your life performance. So that's kind of what I want to do. I want to be a health influencer, health celebrity. And if Instagram is a way for me to get that, then I think that's amazing. It's such an opportunity. I've met some amazing people, and I think it'll continue to be all pro.
Yeah, one thing that I've noticed with all the guests in my podcast, they're always self-starters because obviously who else would respond to a cold email or like a cold text or whatever? They want and search out new opportunities in medicine. One thing that I always get confused about this Instagram world, and we were kind of talking a little bit about this earlier, is that it's kind of hard to grow a following when you have a professional job and professional duty to your patients outside of just the Instagram stuff. So how do you manage the time that you allocate for the different ventures? And you were talking a little bit about automation and how you learned how to use that or grasp that for your Instagram. What are some techniques that you've learned since starting on this entrepreneurial path that allowed you to become a better time manager for studying for med school? It can be applied to many different things, right?
Yeah. So I think that's kind of a two-part question. The first being, how do I allocate the time for Instagram? Yeah. The second being, how do I, justify it with what I do professionally, which is very different than, the fun and games that are kind of social media, what it is.
Yeah.
It's very serious. It's healthcare. It's life and death. And, the people at the top at healthcare facilities and my medical school, they're not always very receptive to it. So there's a line there. So I'll address both one at a time. In terms of life balance, people think that Instagram or social media takes up a large, significant portion of your life. And it can if you let it. And if you're engaging with all of your followers all day, every day, you're searching through your feed, which is that's where people really lose the time. Is when they're sitting there searching and they're consuming instead of producing. The producing actually doesn't take very much time. Mm-hmm. I go out there once a month with Ben and some fellow influencers, and we take content for the entire month. You don't see me posting every day.
Yeah,
it's really one day a month we dedicate to content, and every 3 days to a week we'll sit down and post the content, and that takes 30 minutes. And then I do like to try and engage with all of my followers. I answer the DM. And I try and respond to as many comments as I can on my pictures. Just as Gary Vee says, if you have the audacity to have followers and people engaging with you and you're not engaging back, then who do you think you are? Totally agree with that. Automation has been a great tool in saving me time in terms of exposure, really getting my stuff out there, reaching the right people. You can spend hours and hours following, liking, commenting. Automation's been a great tool for me to do that. If anyone's listening and they want some automation tools, be sure to send me a direct message and I'll help you out. And then the other question was that separation between what I do on social media and what is expected of me as a doctor. And I've had a lot of blowback from even Instagram followers. I would never see you as a doctor. You're not serious. Yeah. And, my dean, I got called in and had to have a conversation about it. And that's not just me. That's a lot of friends of mine. The hospital administration called him in to have a conversation with him about it. And it's really, you just have to know the line. You have to know it's a very strict line. No filming in the hospital. Mm-hmm. There's HIPAA violations that you don't mess with at all.
Right.
And you have to be careful what you say. I mean, I know I'm a medical student. I shouldn't be giving health advice yet. I don't have a degree.
Right.
And I'm very aware of that. And I stick to that strict line of rules for myself. Right now, it's all fun. It's advice for pre-meds, things that I'm allowed and educated enough to talk about.
Right.
So you draw a fine line and you figure it out, and you don't step on any toes. Because right now, there's a lot of people that basically own me and can decide if I graduate or not. So, I don't teeter. I stay on the safe side.
So, why did your dean call you in? Well, how did he find out that you were doing this business? Or did someone tell him, or did you tell him that you brought it up or something? Like, I don't think you would bring it up, but like, how did that happen? I don't want to I want to make sure that that's an okay topic to talk about, but I was just curious.
It is, and it's actually a funny story. And this is my first time talking about it live, but it's great. So my third year of medical school, and I've learned that, the more you achieve, the more people that are going to be trying to take it from you and bring you down. My dean got an anonymous email, all of my deans.
Oh, wow.
Yeah, an anonymous email about me, basically telling them about all of my businesses, my Instagram, how it's unprofessional, and then some crazy attacks on my personality that were totally untrue. 2-page letter to all of my deans. I had to go in there and sit down and talk to them.
Someone took the effort.
To use Gorilla Mail and signed it anonymous.
Got it.
So that was just an insane experience. But that's how they got the information. Someone did that. I went in there. We talked for 30 minutes. I don't know how to handle this. Yeah, it is what it is. Obviously,
that's crazy.
Yeah, and they had me take a video off of one of my business websites, but that was it.
Okay.
Yeah.
So, do you have to talk about this when you're going through if an attending or something on your third year found out about your social media, and you know that attending's very old school and they're not about this new age social media entrepreneurship type of personality in medicine, how do you deal with that? How do you spin it in such a way that your attending doesn't give you like, I don't know, a bad grade during a rotation that you're interested in maybe for residency?
Yes, I've worked with a lot of different attendings.
Right.
And I think the ones that don't like it or wouldn't like it generally don't get the information. I've never had any blowback from attendings. Like, oh, you're the social media guy.
Okay. I was just wondering because the deans found out, right? So like, it's not a far path to like, tell about like the attendees and stuff,
absolutely. And the deans found out through the email. That email easily could have gone to the attending.
Yeah.
It didn't.
Yeah.
And if it did, I don't think there would have been any recourse.
Right. Yeah.
It's very PG.
Yeah.
The whole thing.
That's really nice that you were able to like do the two things and grow one thing while also doing school. Another thing that I usually talk about with my guests is how they see medicine changing in the future. And this is a really interesting topic to talk about, especially in the age of social media, because patients interact on Instagram and stuff. And you were talking about producing content to get to patients. How do you make sure that patients follow you, since the content is basically for pre-meds and fun right now? How do you vision making that transition? And also the people who are on Instagram are probably, there are inequities in the healthcare system. Some people don't have access to phones. Some people don't have access to Instagram. So patient advocacy is important, but how do you bridge the gap for getting the healthcare information to people who really need it versus like people who are just scrolling down Instagram, even though they're like healthy 20-year-olds, So I guess those are two questions. But first is, how do you envision yourself transitioning to this new model that you were talking about? And the second thing, how do you reach people who really need the healthcare?
Definitely. And I guess the first question is, how do I plan on transitioning and where do I see the evolution of medicine going? And I think this is a super important topic for everyone in healthcare to start thinking about.
Yeah.
Because it's really where you should position yourself with what specialty you choose, what topics you want to learn about and pursue. And I think right now the entire world and everything in it is going virtual. There's going to be less office visits. There's going to be less direct contact. Telemedicine is making a huge up and up. And that's not what I want to go into, telemedicine, by the way.
Okay.
It's virtual healthcare, which is totally different. And I just came from a 3-day conference in Atlanta about this exact topic, how healthcare is moving more and more toward virtual. What that really means is bringing healthcare advice to your home, making it fully accessible, making testing more accessible without the act of people travel over an hour to get to the doctor's office at some of these clinics that I go to be told information by doctors who who have said the same thing 1,000 times.
Yeah.
And they're not in it. They're not in it to convince you. And I think the whole process can be improved. And I want to be at the forefront.
So do you think that the moving forward in healthcare to a virtual model, will that reduce the bedside manner that like patients are expecting from physicians? How do they cultivate that relationship when everything's at the tip of your fingers, but you're not actually seeing a person?
Yeah, I totally agree. And I don't think that doctor-patient interaction, physical interaction, is ever really going to be replaced. I don't think you can, especially when you have a sick patient and you need to diagnose them.
Yeah.
You need all the tools in the book. You need your eyes, your hands, your ears, your stethoscope, and there's just some things that don't translate. But preventative medicine does. And that's really where I see, and preventative medicine is a monster. It's huge. Mm-hmm. And I think it's the base of the iceberg. It's the most of it. The top is what you see in the hospital when people get sick. And it's not the majority of people and what they're dealing with. So I think if you can bring virtual healthcare around preventative medicine, put it in the homes, great. I don't think it'll ever replace the patient in the hospital who has pneumonia, they're being treated, or cellulitis. You need that interaction. You need the doctor there.
Yeah.
But that'll never be replaced ever.
Okay. So going into we went a little bit into your background, like third year of medical school, but if you were starting medical school over, is there anything that you would do differently? Would you get started with Instagram sooner just because it wasn't an up and coming invention or field until recently? We didn't see influencers all the time, and like even 2016, 2015, 2014, like Instagram was just coming up when Facebook bought it, right? So would you get involved in Instagram sooner so you would have a early presence on the platform, or how would it work?
Hell yeah.
Okay.
Yeah. If I knew what I knew now, I would have gotten involved back in high school. I mean, the sooner you start doing these things, the better. Waiting is never the answer. And that's the same thing with my podcast, my YouTube channel. Just building your personal brand in 2019 is the most important thing that you can do. And you're doing an awesome thing like going around meeting people, creating this content. People want to hear this stuff. And yeah, if I would have known what I know now, I would have started way, way earlier.
So what are things that you see now that have the potential to become like Instagram in 2025, whatever, or 2020?
Yeah. And, I guess you always have to be on the lookout for the next big thing.
Yeah.
And I think that's video. I think a lot of the younger generation spends way more time on YouTube than they do on Instagram.
Yeah.
When they're searching for things, they search on YouTube. They don't search on Google anymore.
Right.
So that's a really interesting fact that I came across.
That's interesting. Where'd you hear that? Because like I still use just like the top bar on Google Chrome whenever I search. Yeah. And that goes to Google automatically.
I think it's generational.
Okay.
I think it really is. And I heard this on a Gary Vee episode.
Okay.
I forget who was interviewing, but it was a marketing genius. And this is what they were talking about, how the new generation is on YouTube and you need to be on YouTube.
Yeah.
Creating video content.
I mean, that's interesting because I'm on YouTube a lot of the time myself. And I think that the content that I search up, it's varies from like education stuff like Khan Academy. Like basically YouTube has taught me all my classes, and then also like for fun too. So it's like spans the gamut of my entertainment viewing. Yeah. Instagram's there, but there's always a YouTube link in someone's bio, or like, oh, I'm doing vlogs or something like that.
Yeah. And same here. I still spend a ton of time on YouTube. I've got YouTube Premium. Totally worth the investment. Yeah. And there's a student discount. But yeah, I think video is the new thing. So
are you doing like vlogs, or are you planning on trying to do vlogs in the future? Or like how's that looking for Jay Feldman in 2019?
Yeah, so I'm still trying to find some structure to the YouTube channel.
Okay.
A lot of it right now is virtual interviews with people that I think are influential in the healthcare field. Mm-hmm. And I've also been doing a lot of tips and tricks, habit forming stuff.
Got it.
And I'd like to talk a little bit about, business. And once I graduate and this evolves, I'll talk about healthcare. And my eventual goal is help doctors kind of break free of the traditional model and find happiness if they're not happy.
Yeah. And something that's antithetical to like the doctor persona is that we spend so much time in education, so that entrepreneurship is a very risky venture. And people who want to get the MD degree or the DO degree, they're very risk averse. They're not trying to branch out a lot. There's a set path, and that's how we're going to follow it. How did you cultivate that entrepreneurial spirit while you were in such a hierarchical system like pre-med, MD, or DO, and then residency, etc., attending,
Yeah, and I totally agree. The entire medical system is risk averse and not trained in entrepreneurship or finance.
Yeah.
I've never met people more financially illiterate than doctors. And with that, I think there's a lot of opportunity. You said, how did I cultivate it?
Yeah.
I've definitely been cultivating it, but it's been there the entire time. My first business I started before I ever started medical school.
Okay.
So this has always been a part of who I am. And over the years, I've taken a lot of tips and tricks from virtual mentors, Gary Vee being one of them, Tony Robbins, Oprah Winfrey, on basically their lifestyle. I mean, entrepreneurship, it is a lifestyle.
Right.
You can ask any of my friends. It's from the time you wake up in the morning to the time you go to bed at night. And that stays with you. And a lot of it is hardwired and a lot of it is learned.
Right. Yeah. And so I'm trying to grow my Instagram in 2019, right? I'm a person who's going to medical school. I want to grow my Instagram. But something that I find different from my view of how to grow my Instagram versus a lot of traditional people who go on Instagram is that I want mine to be heavily research focused. So there's a doctor called Dr. Peter Attia who does a podcast about longevity and aging. And I find his podcast to be really, really cool, although it's kind of indecipherable for people who aren't physicians because he goes very, very deep into the science. He goes into LDL particles, LDL count, blood tests that he does. He has a CGM, even though he's not a diabetic, and he does blood tests every single 2 weeks just to test his levels of beta hydroxybutyrate and stuff like that because he's on a ketogenic diet. So something like that interests me. But I was just wondering, for communication to the patient, how do you see that playing into medicine? Like when you become a doctor, how are you going to communicate that very complicated information to a patient about, I know people usually say, oh, eat your greens, eat your veggies, but a lot of people don't follow that because they don't understand the relative risk or the incidence of diseases as doctors do. So how do you portray that seriousness to patients?
Yeah, and that's a good point you brought up with the audience, because when you're talking about something so specific, and by the way, I would want to hear about this podcast. That's exactly what I'm interested in currently studying. But yeah, when you talk about something like that, your audience is so small. Only physicians are going to understand this. And only a small segment of those physicians are going to be interested in longevity and what you're talking about. The reason I went into family medicine is because what you learn is so diverse.
Right.
And it covers all of the main health ailments that, affect 90% of the population. It's the diabetes, the hypertension, nutrition. And these are the things that I want to talk about on my channels, because you can make it very understandable and relatable to a majority of the audience.
Right.
And if you attack these main health conditions that are affecting the majority of patients,
right,
you're going to make the biggest difference. I mean, it's the diabetes and the hypertension that leads to most of the more advanced things.
It's actually interesting that you mentioned diabetes, because he talks about the 4 leading causes of death, and diabetes is actually not one of them. It's like, I think it's cardiovascular, CHF, Alzheimer's, cancer, and accidents, actually. Mm-hmm. So, but diabetes is a big comorbidity to all of these conditions. Like people have diabetes and they also have chronic heart failure and stuff like that. So it's interesting that you mentioned like that you tackle those 2 issues. And as a family, as a doctor who's going into family medicine, you mentioned before, what do you think that family medicine practitioners right now can do to kind of grow their social media presence, or maybe target patient audiences that they aren't targeting right now as just a practicing doc?
For marketing purposes, to get patients in the door, or to help their current patients?
I think that they can do both by using social media, right? But I was mainly talking about educating their current patients, because they see them on a day-to-day and they're trying to cultivate a relationship of to get into that virtual medicine field,
I'm willing to bet every single doctor that has a population of patients, if that doctor were to start a YouTube channel where they were to put their best stuff out there, really put like a day into each video,
right,
have them professionally edited, their patients would all watch these videos and they would love them, mm-hmm, and they would get a lot out of it. Doctors get tired of saying the same thing over and over again. They're not giving it their 100%.
Yeah.
6 times a day, every day, to someone who's barely listening. But if they had a channel or an outlet to actually educate their own patients and future patients, then all of a sudden they're an expert on the field. They have content out there. People are watching it. Not only is that going to bring in new patients, but it's going to help your existing patients.
Yeah.
Whatever channel you pick, I don't think Instagram is the right channel for that,
right,
because it's short form content only.
Yeah.
But if it's IGTV, YouTube, and YouTube is the channel I would suggest,
right,
they need to start doing it.
Got it. And what I watch is different, obviously, than other people watch, what patients might watch. But my question is kind of talking about people want to watch something that excites them, right?
Yeah.
So, but he's always preaching about hustle and stuff like that. And that's like something I feel that's cultivated in med school a lot, just because you have to hustle for the step 1 score, for the step 2 score. And then it's like graduation, residency. It's like always, you're always on the hustle.
The difference, I think, and sorry for cutting you off, is it's a very different type of structure.
Yeah.
Medical school gives you a structure. Like you go to take the MCAT, you go to medical school, you take the boards, you go to residency, you take a job as an attending.
Mm-hmm.
It's hard. You have to hustle during all of those steps. That's hard. But the hustle they're talking about is different. It's when you wake up with nothing to do.
Okay.
There's no studying. There's no anything. What are you going to do at that time?
Right.
And for me, I wake up every day. I go through my morning ritual, and then I sit down and I write a to-do list at breakfast.
Yeah.
And most of it's not medical stuff. Most of it's, all right, I'm going to make a video on this. I'm going to make a video on this. I'm going to edit this video. I'm going to implement this on my website. It's really being creative in how you're going to build that personal brand for yourself. That's the hustle that I think that they're talking about and that I preach.
So do you also preach, you said consistency and stuff. You said only 1 day a month and I'm able to automate the posts, basically to make life easier and work smart, not hard. Do you suggest that someone in their first 2 years starts a business just because they are very focused on that step 1 score, right? Because like it or not, that's how residencies evaluate whether they're going to accept or decline. That's what gets you your foot in the door, basically, for an interview where you have to talk about other stuff that you've done. One thing that a lot of entrepreneurs in med school that I've seen, they all started in their third year. Mm-hmm. That's interesting. Like, I don't know if you know about the Strive to Fit's YouTube channel. She's a YouTuber who's also an emergency medicine resident in New York, actually. And Dr. Kevin Jubal, he was a guest on the podcast. He started Med School Insiders, which was a YouTube channel which has video essays about being productive, because he was able to match it to plastic surgery residency, which is one of the most competitive residencies. And a lot of them started it in their third year. And I just find that like pretty fascinating, because did you think that you didn't have time in the first 2 years, just because it's very time intensive in terms of studying for your classes? So
I wouldn't recommend anyone starts a business during their first 2 years of medical school.
Yeah.
Probably even their third year. I
Okay.
mean, and third year is so variable. There were some rotations like pediatrics where I was in there for 4 hours a day.
Yeah.
But surgery, I was in there 14 hours a day. Tell me to start a business or run a business during surgery, I'll laugh in your face.
Yeah.
But I had those skills built in where I was able to have a manager kind of run the show when I wasn't present.
Right.
And that's something I've been able to continue to do now. And hopefully we'll be able to continue to do through residency. But in terms of, I'm in my second year of medical school, should I start an Instagram channel? Yeah, absolutely. Yeah, and thank you for having me. So if you want to follow up with me, my Instagram handle right now is currently @_JAYFELD. That will soon be changing when I get my degree, so keep on the look. It'll be at doc.jay. My website will be launching also when I get my degree, drjfeldman.com. Already secured, already established. And yeah, you can find me on my YouTube channel. I also have a podcast. Twitter I'm not so big on, but Facebook's there. You can consume me wherever you want. And if you want to get in touch with me or ask me anything about this interview or from this interview, I am very responsive with my DMs. If you send me a question, I'll answer it.
Yeah.
So that's the big thing.
I know firsthand.
Yeah, if you send me a question, I'll answer it. But yeah, thanks so much for having me. This has been awesome.